Hello, my name is Dr. James Seamer from Seamer Health and Wellness. Today we're going to discuss the sacroiliac joint, which is the most important joint in the body. It's the foundation of the spine. It literally holds and supports the weight of your whole entire torso on the left side and the right side. And you're going to see why this is the most important joint in a few moments. I'm going to go through some information that I think would really help you understand truly what's going on with your problem. The cause of most low back pain is a problem with the sacroiliac joint. Over the many decades, the majority of the times when patients come in, you can basically almost rest assured that's the sacroiliac joint. And usually we know from many different responses that the patients get. So sacroiliac problems cause the following conditions. You cannot stand for any length of time. You cannot sit for any length of time. This is because when you stand, when you have to support the weight of the body, you can't stand on that side. So you kind of shift your weight to the other side. So if you find yourself shifting your weight to the right or the left, that's a typical sacroiliac problem. You cannot sit for any length of time, mainly because you sit on your sacroiliac joints and you further separate the one that's the big problem. You usually develop pain down the side and the front of the leg, but not necessarily. You can have pain going and radiating down the back of the leg. Rolling over in bed wakes you up. You find yourself bent over from the pain. You can't stand erect. You have hip and knee complaints, and you have severe arthritis. Not just in one joint, but a number of joints. Now, there's many causes for this, but let's give you an idea of exactly what's going on and what kind of stresses the sacroiliac has to put up with. Man is the only living creature who stands upright and is biped. Scientists agree we stood upright 2,000 years too soon. So our back is still going through modifications to help improve the function of our lower spine. Not to mention that we're biped. This means that you can develop sacroiliac joint problems very easily, and I'll explain why. It's basically caused to having two legs and one pelvis. So for example, if a person's weighing 150 pounds, they're supporting 75 pounds on each sacroiliac joint. Now, just when we start walking, let's see how all this starts to multiply out. When you walk, it increases our body weight by 2.5 times. So now a 150-pound person will be exerting 375 pounds of stress into each sacroiliac joint. Running or jogging, it's worse. It's 3.5 to 4 times. So now a 150-pound person has 600 pounds of stress into their low back. Picking up a 60-pound box exerts almost 1,500 pounds of stress into your sacroiliac joints. How's that? Squatting. With 300 pounds, you would exert 7,500 pounds of stress into your pelvis. So you can get an idea of exactly what's going on. Look at this. A gymnast vaulting, weighing 100 to 120 pounds, hits the ground at approximately 1,900 pounds of force into her sacroiliac joints. That's incredible. Not to mention falls, injuries due to sports, auto accidents or traumas, and it's further aggravated by increased weight gain as we get older. So you can see that there's almost a guarantee that somehow, somewhere along the line, you're going to wind up with some back pain, and the majority of the time it's going to be basically due to a sacroiliac problem. Now, you're going to see that sacroiliac problems cause a lot of other things, but let's go a little bit further and explain exactly what happens. So now, when you have your sacroiliac joints, they're held together. The sacrum is held together by ligaments to the ilium. And basically the purpose of ligaments, which are these white things right here, is to hold bones together. They create the joints, and you're going to see that in a few minutes. So you have a sacroiliac ligament, you have a sacrotuberal ligament, you have a sacrospinal ligament, you have iliolumbar ligaments. So you have ligaments all over the place. Real thick because they have to support the weight of the whole entire body. So they have to be really powerful and strong. So what happens is that all those traumas that we just talked about damages these ligaments. So all of a sudden you start to develop little microscopic tears, and the ligaments get weak and they get frayed, just kind of like the way a rubber band would. And then that allows the bones to kind of move out of alignment. And we're going to show you that in a simple picture right now. So if you look at the figure 1 on the left, you'll see this is a typical joint. Now that could be a sacroiliac joint, but we're just going to explain it as this is a typical joint. It's always held together by ligaments that we talked about, and then between the joint there's either cartilage, or if we're talking about the spine, there's a disc. Now, the purpose of the ligaments is to hold the bones together, to keep the joint nice and strong and powerful. Muscles attach to the bones by tendons, so they span where the bones join, and they attach by tendons. And what they'll do is when these little yellow things, which are nerves, contract, they cause the bones to move, and the ligaments dictate how the joint's going to move. When you damage those ligaments, such as in the sacroiliac subluxation, those ligaments are really, really traumatized to the point that the sacroiliacs move out of alignment. Now they can't support the weight of the body. So now you have muscle damage, you have ligament damage, you have tendon damage. And it's not just to one little area. You can see that here's the sacroiliac joint, there's some of the ligaments, but you can see now here's the muscles that attach to the sacroiliac joint, your buttock muscles, the gluteal maximus and the gluteal medius, but other muscles underneath, the piriformis, and so on and so forth, the obturators, and they attach into your hip. So they'll lock your hip up and cause problems with pain down the side of the leg, pain down the front of the leg, pain down the back of the leg. And it's basically all because of what's going on here. So you develop all these reflex patterns, and things just progressively get worse from this particular point on. So eventually a sacroiliac problem will lead to spinal degeneration, knee degeneration, hip degeneration like we just explained, foot degeneration, ankle, so on and so forth. So you'll have a lot of arthritis and degeneration occurring from this particular problem. Sacroiliac problems cause herniated disc because the sacrum is the foundation of the L5 disc, which is the subluxated disc that subluxates and basically herniates the fastest. Is when this foundation tilts the sacrum, the disc herniates. There's the disc, there's the sacrum. When that sacroiliac joint separates, the sacrum moves out of alignment, puts pressure on that disc, and eventually it'll cause it to herniate. Sacroiliac problems can cause sciatica. Here's this blue hole is where the sciatic nerve, which is the main nerve that comes out of the lower back into your leg, comes through. You can see how the ligaments kind of make part of this hole, and the other muscles that we just talked about, the piriformis and the obturators, basically form a tunnel that this nerve goes through. If those ligaments start to tear and those muscles go into spasm, it puts pressure on the sciatic nerve, causing sciatic pain. Scoliosis created by sacroiliac subluxations as well. Curvatures of the spine. You can see how when the pelvis goes out of alignment, the spine has to compensate by curving to the right in this particular case, and eventually it goes to the right, then back to the left, then back to the right. So scoliotic patterns can be caused by sacroiliac conditions. Here's another picture just of a child. Now, how do we treat these problems? Well, the reality is that you have to do a thorough examination. You may need x-rays. You may need to look at MRIs. You have to see what kind of damage is going on and how much of an injury that you have and how long you've had the problem. Now, if you have knee problems as a result of this, or disc problems as a result of this, this further complicates the situation. But the treatment is basically the same. You're going to use a combination of what we call neuromuscular reeducation techniques. This is what we use to treat damaged muscles, tendons, and ligaments. It's a hand-on type of treatment which helps us break up all these reflex patterns that develop when the sacroiliac joint went out of alignment. So as we kind of realign the sacroiliac joint, we can get rid of your chronic pain, your strains, your sprains, tendinitis, bursitis, joint degeneration, arthritis, or whatever you want to call it. We can basically get rid of that, and there's really no problems with that, but it just takes a certain amount of time. How long? It really depends on how long you've had the condition, how much damage there is, how willing are you to basically take care of yourself. You may have to lose weight. You may have to do a lot of different things to make this a reality. You'll also have to do some kind of exercise. You're going to have to do either flexibility, progressive resistance, or cardiovascular. And you're going to have to do all three. So it's a whole situation. It's a whole complex program. And the program can really totally change you within a few days to a few weeks to a few months. And sometimes it does take up to a year, depending on how bad the problem is. But I guarantee you, when you start to eliminate a sacroiliac problem, you will not believe how much more health you will have and how much better you'll feel. And I can tell you that sacroiliac joint problems may not kill you, but it will make your life a living hell. I hope this helps you figure out that majority of low back conditions out there, hip problems, knee problems, disc problems, scoliosis, and so on and so forth, is basically caused from a sacroiliac condition. Hope this was really informative. Have a great day and a lot of health.